name is Mike Veny, and I'm a mental health advocate, speaker, author, and I focus on the stigma surrounding mental health.
Hi, Mike. Thanks for having me today. I'm Tyrone Brewer, president of US Oncology for Johnson & Johnson.
Thank you for being here. The stigma surrounding the subject of mental health overall is just bigger than ever, even though we're talking about it more, which is another conversation. And it has some unique layers amongst men of color, but so does prostate cancer. What's behind all that?
Mike, it's a really good question. It's one of those things where I think some of it has to do with, health literacy. Some of it has to do with, again, helping people to understand the importance of just those general maintenance, the checkups. In fact, I find it ironic. I have a group of friends that I have. We in a group text, and literally one of them just sent one out the other day that said, "Hey, fellas, make sure you're getting your checkup." And if you would have said to me, just even as older men now, I would have never expected that kind of message from this group, just as short as 5 years ago. So here's a group of educated men. We have a lot of different conversations, but yet that's the first time that someone has ever said, "Hey, make sure you're getting your checkup." So it just kind of speaks to, again, it's just not a norm. And we have to find a way to make sure that it does become a norm. Because something like prostate, you could be a part of the 96% club. And that is what the survival rate is if it's discovered early.
Mm. It's understood that when someone receives a cancer diagnosis of any type, it's going to affect your mental health,
Yep.
regardless of who you are. From your personal experience with family and your community, how do you think cancer diagnoses like prostate cancer can impact men of color differently compared to the general population?
Well, I think, first of all, to your first point, like you said, I don't care who you are. When you hear those words cancer, unfortunately, there's an immediate assumption of how much time do I have, right? It expedites to a thought of, your death. And so with prostate cancer, I think it's so important that people understand that, again, if you get the checkups, if you get it identified early, actually your survival rate is actually very strong. And you have a higher likelihood of actually dying with prostate cancer. But again, it all depends on time of diagnosis. Unfortunately, today, most people of color are diagnosed late because we're not doing those preventative things. And so it's also important for people to help out. And I think what part of the stigma is their assumption that it's an invasive test. There are other ways to make sure that you can get ahead of prostate cancer. And it can be as simple as a PSA test, which is really done through blood. However, you have to advocate. If you don't advocate, it's not automatically a part of your blood panel. So again, that's why a lot of this, I think, really gets back to health literacy and then again, health equity, people that understand the importance of making sure people of color understand what are these questions that you should be asking. What, as a clinician, should be looking for to make sure I can help prevent this particular disease.
So, in your opinion, health literacy is not just about knowledge, but also knowing how to advocate for yourself.
Absolutely. As we always say, knowledge is power, right?
It,
And you
it
don't
is
know what you don't know, right? So how do you know to ask if you're not informed?
correct. And, speaking of knowledge, I know that I need to get tested. I'm going to say that on video. And I promise it's not stigma over here. It's just my schedule. To reach people, though, who are in our community, who are resistant to discussing it, how can we be more effective in just starting the conversation?
Well, I think this is why programs that we have going now to, again, make this more public, people hearing it from different figures, is a way in which how we can at least begin the conversation. So I'm very proud as an organization, we started something called Talk That Talk. It was in partnership with Shannon Sharpe. So as he's affectionately known as Uncle Shannon, he's someone that a lot of people can relate to. So having different people being able to, because you don't know who's going to be able to connect to make people realize that, you know what, I really do need to have this conversation and I really do need to get checked up. Interesting enough, though, when we started this program with Shannon, little did we know that actually he was a prostate cancer survivor. He wasn't public about it. It wasn't
Mm,
until this program that he actually came out public and he realized the importance of him also sharing to again take away that stigma. So programs like that, programs like the Blue Jacket Fashion Show that I'm going to have an opportunity to participate in on February 1st as another example of again where you're bringing a collection of individuals from fashion, from sports, from news, different backgrounds, and again trying to find different ways to speak to different individuals to again destigmatize the conversation and the importance of making sure you do get that checkup.
and also that group text that we all have on our phone, we can simply send a
Exactly.
message, right?
All it takes is one, right?
Yes. Well, where can people go to learn more information?
Thank you for asking that, Mike. So for the Blue Jacket Fashion Show that's put on by Zero Prostate, Zero Prostate has a wealth of information that can be found at zeroprostate.org. And then for the program that I just referenced, there's a lot of different tools and pieces of material there. That is called talkthattalkpc.com. Two great areas for you to, again, to learn more, to be better informed, to have the right conversations.
Awesome. Well, Tyrone, thank you so much for joining me for this conversation. Thank you for the work you're doing, and we'll talk soon.
Thank you.